Hi everybody. So right now I'm going to go over Clinical Vignette Part 2, which is due Sunday week 6, which happens to be February 26th. So it's not this coming weekend, but the weekend after. I'm going to encourage you all to wait a little bit to look over this until I give you your paper back. For some papers, they'll have corrections and things that you can include to make it more informative. So let's go over this. This part of the vignette addresses the complexities of diagnosis and assessment of the client selected for the vignettes. This paper should be no more than 12 pages, not including the title of reference page. So please don't hand me a paper that's more than 14 pages, including the title page and reference page. If it gets out of hand, I will take off points. And this is just because it should be succinct information and just respect the guidelines. So you're going to use the material from Vignette 1 and update as needed. Update as needed means you'll update it once I give you back my feedback. Add material based on the grading rubric below, which I'll go over. This will result in one combined final paper. So this is Clinical Vignette and Clinical Vignette 1 and Clinical Vignette 2 put together, a cumulative paper. Signs and symptoms and rationale, assessment using DSM-5, reassess the individual based on all diagnoses covered in the course, and you must include at least 3 references for this paper. Websites, the DSM-5, and textbook do not qualify. These resources should assist you in making diagnostic decisions related to the client's presenting problems and psychosocial factors. So if we're talking about 3 references for a paper that do not count for the website, DSM-5, and textbooks, what we're looking for is scholarly articles, which you can get through the Widener online library. If you need assistance in this, I believe that there's a video in your student resources on how to use the Widener library, but if you have any questions, you can let me know. If you need more clarification on what resources or 3 references you could use, please email me before you put too much thought into it, but please do not use websites, the DSM-5, and the textbook. I will take off points if you use some sort of website or the textbook. And in addition to that, you are using the DSM-5 throughout the paper, so you still are going to put that on your reference page. That's just not included in this 3 references. So the first part of Clinical Vignette 2 will be Clinical Vignette 1. So any information that you need to include, fix from my feedback, that's what this will all be. So this should all look very familiar to you. And then Vignette Part 2 starts here. And it starts with signs and symptoms and rationale. Assessment using DSM-5 symptoms. So you're going to reassess the individual based on all diagnoses covered in the course. So this is building upon what we've covered in the weeks since Clinical Vignette 1 has been due. So again, you're going to define the person's challenging behaviors and other behavioral manifestations of possible symptoms and/or actions of the person. State what behavioral manifestations may relate to signs, symptoms of diagnoses covered in the course. Assess the person and determine 2 to 3 possible differential diagnoses using the behavioral manifestations to support the symptom choices. Give a rationale for each differential diagnosis. Make a list of rolled out diagnoses and choose a working diagnosis. So give a substantive rationale for your diagnostic decision. Use DSM-5 terminology. G of this section, based on the person's life experiences, identify diagnoses not listed in the differential and working diagnosis that the person may be at risk to develop. List the person's current medications. So if this hasn't changed, you could say that, and then you can discuss whether your diagnoses match with the current medications. The next section is summary. This should be at least 1 page. Discuss how you resolve differential So how did you come to the differential diagnostic challenges? In the process of working through these diagnoses, how has your view of the individual changed? How has your view of the presenting problem changed? How have your expectations of the client changed? How has your view of the person's original diagnosis changed? What changed for the client? Address your countertransference feelings towards this client, which will make more sense after week 5. And then lastly, well, for the summary, I mean, it really is just a summary of what has gone on so far. And if this paper seems a little bit repetitive, there is a purpose for that, a learning purpose for that. And lastly, you must include at least 3 references for this paper, like I already discussed, not including websites, the DSM-5, or textbook. These resources should assist you in making diagnostic decisions related to the client's presenting problems and psychosocial factors. So these are scholarly, peer-reviewed articles that can be found through the Widener Library. Again, if you have questions on that, let me know. Usually when I do this paper, I grade this paper, people lose points on this section. But as a professional discourse, you should be using peer-reviewed scholarly articles through online databases. Again, this is a 12-page limit, not including title page and references. And as always, APA used to format. This is also a section that a lot of people lose points on, but if I correct your APA in your Clinical Vignette 1, please do fix it in Clinical Vignette 2. If you have any questions, do not hesitate to let me know. I hope that this was kind of clear. If you have any questions about signs and symptoms or rationale, I would encourage you to again watch Ginny Facknew's video one more time before kind of delving into this section. Okay, send any questions you have my way. Again, do so within enough time for me to get back to you. Most of you know that I try to get back to you as soon as possible, but the closer it gets, the harder it is for me to answer within a timely manner for you to complete the paper. So, best of luck, and I will talk to you all soon. Thanks. Bye.